Thank you very much. I feel a little unqualified to talk. I'm going to switch a little bit and ask Dr. Toniolo to stick around, and if you have some questions, because I'm sure you may. What I wanted to do this afternoon was really not talk about any specifics of post-polio research, but to talk about the bigger picture of post-polio research and the why and the what. So I began working at our organization, which was established in 1960. I started working there in 1987. And with enthusiasm, I called a neurology professor at Washington University in St. Louis to discuss post-polio research. And he told me rather quickly and succinctly, number one, if I was on a committee to review grants about post-polio syndrome, I would vote no. And secondly, young lady, I would advise you to forget post-polio research. What you need to do is to get your people to accept what is happening to them. It's wear and tear, and it is aging. Over the years, I have heard these comments many times. There are more serious conditions to study. Donors like to fund cures, and you are aging, get used to it, or you're dying, and we are. So those are the comments that I've heard, but for some historical perspective in reference to post-polio research, before I talk a little bit about what we do, here is the oft-quoted late changes in the motor unit after acute poliomyelitis by Weekers and Hubble, which was published in 1981, one of the earlier studies in reference to post-polio research. In 1981, that was the same year that our organization hosted our first post-polio conference in Chicago. We had another one in 1983 and also one in 1985. In 1985, the whole Journal of Orthopedics talked about the late effects of polio or post-polio sequelae. And I've been asked, why was it in orthopedics? And to this day, many polio survivors turn to an orthopedist when they start having problems, because that's who treated them when they were children. And so that was one of the reasons why it was logical to have it produced in orthopedics. More perspective on the history. We had our fifth conference, I think, fourth conference in 1987, and it was the most attended conference that we ever had. There were 650 people there because the word was out. And also, as you can see here in 1986 and 1987, information about post-polio and post-polio research was published in the New England Journal of Medicine, which certainly helped legitimize the whole idea about post-polio and post-polio problems. So I want to go back then to a little bit about the why and the what, which is what I said we would talk about a little bit. PHY is that our mission has always been to enhance the lives and independence of polio survivors and home ventilator users, or i.e., we're concerned about independent living or disability rights or quality of life of polio survivors through education, advocacy, and networking. But in 1995, we did add supporting research to our mission, and the reason we were able to do that was that there was a gentleman named Thomas Wallace Rogers, who was from Central Illinois, who was a polio survivor and was also in an iron lung, who was what we would call today in wealth management, and he was good at wealth management, and so when he passed away, he left some money to us, and that's how we started our research fund, which has allowed us to fund studies such as the one that Dr. Toniolo is talking to us about just a little bit ago. So a little bit about our fund. It was initiated by him to this date. We have funded 10 grants. The amount we've given has been $395,000. Currently, we have $770,000 in the fund. we'd always be willing to let anyone help us increase that amount. 50,000 of that is already committed, but our next call for proposals will be in 2017 for research in 2018. Here is a list, and all of this is on our website, and I'll give you the reference. Or if you've got your little flash drive in your bag, you can put that in your computer, and it'll link you to all these different studies that we have funded, and also other information about our organization. So we started offering, the fund was started in 95. We started offering grants in 2001. And here's a list of the grants that we have studied. About ventilator users' perspective, part of our work that we do is with ventilator users, and that's really the history of our organization. We started out with people with more significant polio problems and people who had breathing problems. A study in reference to women with polio and menopause, the timing of when you start non-invasive ventilation for ALS, and the sooner the better. Pilot study to identify a PPS biomarker. 2009, which was a study persisting non-infectious fragments of poliovirus and PPS, and that was one of the earlier work that we studied of Dr. Toniolo in 2009. 2011, we awarded 2 grants. One was about glutathione, and then also the characteristics of poliomyelitis and post-polio patients among Arabs and Jews in Jerusalem. And a part of that was they were doing some comparison, but also it was a younger cohort of polio survivors. All of these studies, they're required to give us a mid-study report and also a final report, and so all of those are on our website. And again, you can find the link and read all the summaries of that. Some of them have also had things published in journals. The most recent ones is about the effects of the whole body vibration on people with post-polio syndrome. We'll have an update on that. She gave us a short summary. She is in the process of submitting that for research and in publication, submitting it for publication, and she hopes to have that published soon. You just heard from Dr. Toniolo about the 2014-2015. And then our most recent one was an award for a cough assist, which is a device that helps people cough better. And the benefits of it and the use of it, and one of the reasons that is important, a lot of people have them, they don't use them, and there needs to be that there is also prove the benefit of it. It has to do with policy, because if it is prove that it does keep people out of hospitals, et cetera, then the funding of it or the payment of it would be more likely to happen. So that's kind of a real quick summary of what we've funded so far. As an organization, we try to be a conduit for the ideas of polio survivors, and we try to provide a voice for polio survivors who are not often heard. So when I with Marianne and the group asked me to talk a little bit about this, I asked polio survivors, some of our members, through social media, why do you think that we should have post-polio research studies, and then what do you think that should be studied? So here a list of people who responded, and here are some of their whys. And this is what polio people speaking to us as an organization and to researchers. Knowledge can be applied to other viral illnesses. Research can lead to policy changes. Polio is still not eradicated. People are opting out of vaccinations, mutations. The sense that survivors of the 20th century can be helpful to polio survivors who are in the 21st century, and then people don't know that they had polio. We asked them, what did you think should be studied? And there was a whole list of things, and I kind of grouped them into, I guess, 3 different ideas. One would be kind of cause and system related, and it really, I think, it's based on people's personal experiences. They're interested in knowing about progressive new weakness, what factors contribute to it the most, compare pre- and post-surgery weakness. Quite a few people are interested in pain in post-polio. Who has pain? Some people do, some people don't. Why not? Fatigue, especially cognitive ability, drug interactions with polio-weakened muscles. Some people are real specific. Pursue inflammation as one of the causes. Develop a marker for post-polio syndrome and then a vaccine to prevent it. And explore hypnotherapy as an influence on neurological repair. The second group was ideas about surveys. I can say that other people have said, I'm tired of surveys. I'm tired of you asking me, the questions, over and over, and it seems like all they want to do is count us. And it would be nice if do other surveys, but some people are interested. Survey the breathing problems of survivors before and after anesthesia, immune deficiency in polio survivors, how many have it, what are the causes, are they different causes, and then a survey about incontinence problems and elimination problems. And I guess I would add also about surveys, and I think researchers are getting better, and I think it's just the culture, but early on, you did feel like that we were just being surveyed and you never heard back from them at all. And now there is more of a sense that it is an obligation and a responsibility. And also, I was at a meeting in Lyon where a professor talking about surveys, and that he got frustrated with them because if you set up an expectation that you're going to offer some kind of solution, and many times that doesn't necessarily happen. Which takes me to the next section of what people thought we should do some research on, and it really is kind of the idea of, well, can't we move on to solutions, or the ideas of living with polio? And again, you can read those, what helps, what makes things worse, what doesn't make any difference, in reference to like bracing or exercise or medication. They ask about best practices for managing aging with polio, and pain, fatigue, breathing, and difficulties. And you can see they added, and still remain active and engaged, and that is important. And this was the next one about explore various styles of adapting to our changing health needs or ways of coping. So there was kind of an acceptance that we do need to adapt. So what are some of the best ways that we can do that? The next one was kind of rights-based. We talk about sometimes when we see health professionals, we don't feel like we're getting, let's say, the proper kind of treatment, and sometimes we interpret that as being that it's the lack of the person's medical knowledge, and there's been some suggestion, not just within the polio community, but there is some sort of a bias against people with disabilities in reference to the kind of treatment they may get from health professionals. And then there was some concern about establishing some standards in reference to protocols for evaluation and also for treating different kind of diseases. We had done the survey of health professionals, which I reported on yesterday, and in that there was a section where we asked health professionals, had they been involved in research, and 29 of the 49 said they had, and I didn't list that, but what we did ask was, if you don't participate in research or you haven't as a health professional, what were the barriers to doing so? And some of them said, well, there were just none in my area, or they were unaware of any studies. Time was a big one. They just didn't really have time to do research. They thought that PPS is a diagnosis of exclusion. It really makes research difficult. And then there was, lack of participants in trying to do research. And then some people said some of the studies that were done, they didn't necessarily agree with the protocol, so they weren't being involved in the study. Excuse me. So back then to another PHI's what, being really specific about our what. We do have the grant that we do offer, and we want people to do studies in these areas. It's the treatment and the management of the late effects of polio, or to explore the historical, social, psychological, and the independent living aspects of living with polio. And if you recall, the gentleman who donated the money to us to start the whole thing was in an iron lung, so he was interested in the respiratory part of polio. So we also asked for that part of it, the management of neuromuscular respiratory insufficiency, or to explore the historical, social, psychological, and independent living aspects of long-term home mechanical ventilation. And so those are the two areas of research that we have established that we're interested in. And we also have this as criteria. The research must improve the lives of polio survivors and the users of home mechanical ventilation. We are looking for the improvement of the lives. It could be qualitative or quantitative research. We obviously accepted research methodology. We do have a preference for innovative or original research, which leads to new inventions, products, methods, or new applications, because again, we're interested in some results that will be helpful for us, if not immediately, in the immediate future. Starting in 2013, up until that time, we gave $25,000. We expanded it to, it was $25,000 every other year. In 2013, we changed it and expanded beyond the basic sciences to do the social and the historical. And we also decided to offer an annual award, and the annual award was increased to $50,000 up from $25,000. Our next call, like I said, will be in early 2017 for funding for 2018. So you can check that out on our website if you're interested. Go back to the accepting and the idea about myths or myth busting. There are fewer polio survivors. That's just a fact. And there are many, though, who are also living in emerging economies. And so we do hear from people, like the last grant that we did award was dealing with the cough assist, which is a several $1,000 machine. And to people in some countries and emerging economies, it isn't really helpful for their polio survivors for us to spend money studying a machine that costs thousands of dollars, which they're never going to have. So we are aware of that. There are more serious conditions to study. Yes, of course, we know that. There is cancer, there is ALS, there's Zika, and we are aging, we know that too, and we're dying, we know that too. But meanwhile, we're still here, and so we're interested as an organization to help fund projects that will help us as we go along. Busting myths, is there a hierarchy of diseases? Probably. We have a tendency to focus on the current threat. Zika is a funding priority right now. It is a threat, it's a fear of the unknown, and so that's important to people. Post-polio problems are not a threat to the public, whereas Zika would perceive Zika to be. Should numbers, be a determining factor? Some of these are rhetorical questions based on, things that people have said. I don't know that I necessarily have, all the answers to that. And I welcome you to have some comments. Do researchers and donors, do they seek fame and fortune? We've been told, you're not a sexy disease, so nobody wants to, I don't know. I think one of the things I think about is who's the source of the comments, who's saying these things, are they qualified to speak? We have learned in the United States that recently that There are people who talk a lot and we're not necessarily qualified to speak from our current election. So I think not everybody is qualified to speak. But the real issue, I think, is the last one. Should we listen? And that's what we have to decide when people are saying these things about research, where you're all dying and et cetera, et cetera. Yeah, are they qualified to speak? But the most important thing that we can control is, should we listen and and pay attention to them, or should we not? There are some current concerns, I would say, in reference to post-polio research from how we look at it. Some of the studies that we have funded do struggle at times to get participants to be involved, and sometimes that's a lack of understanding of the process of research and wanting to be involved, and it's also of the benefits. I think that there are, the networking is great, but there are influencers, I think, on the internet, and there are influencers in support groups, and sometimes people will say, well, I tried that and it didn't work. And then if there's a study going on, the rumor goes, well, don't do that because I tried it and it didn't work, which really leads to the second one, which is that there really are so many faces of post-polio syndrome that I think that sometimes we think, we're going to study post-polio syndrome, here's this one problem, and then we're going to find this one answer. And that's certainly, we know from everything we've heard in the last 2 days, that's certainly not the case. And so saying that it doesn't work for me doesn't necessarily and would not apply to someone else. Grants are easier to obtain than implement. Talented people, as I say, are really, really busy, and I think sometimes that is a concern. And another I would just comment is that we have found that researchers have a tendency to only apply once, and we would encourage people, if you've applied before, apply again. Just because you didn't get a grant in a certain year doesn't necessarily mean that you would not get it, the next year. It just kind of depends on how many we get, the vetting process, and how, it's stacked up in reference to the other grants that particular cycle. There is definitely an increase, I think, for the need for funds to study post-polio research. And here's all of our information. If you have any questions or comments that you want to say to me, to us as an organization about any of these things, you have answers to any of those questions, concerned, please contact us, info@post-polio.org or director@post-polio.org would also work. So I'm probably over time, but I really would, maybe we're all over time, but if you have questions for Dr. Toniolo from some of his work, but that's up to Tessa and up to Marianne, whether you want that to happen or you want us to just go away. But anyway, there you go. Thank you very much.